Search on pseudomyxoma, one of the first things that comes up is the Christie, but also Steve Prescott, because Steve was a pioneer, and so they hear about the Christie, they hear about Steve, and they come to the Christie, and we assess them properly. We have a multidisciplinary group, and we look at their radiology, their pathology. We look to decide, look, is surgery really going to help? And we can really provide a very good surgery for probably about a third of people. When we first started in about the year 2000, we only had a few referrals, and now we operate on probably, I think it's about 3 or 4 people, maybe 5 people every week with this type of problem, whether it's a pseudomyxoma or whether it's a bowel cancer. We also have a big research department as well, where we're looking, for example, at the type of genes that are involved in the spread of cancers, and what we're hoping is to use that research to provide better treatments for patients with the pseudomyxoma and also with bowel cancer as well. There's absolutely no doubt that this type of surgery with the chemotherapy really helps patients, and so it definitely does. But we also look for other things as well. We're looking for the quality of life afterwards. We're looking for the financial effects afterwards. So we're looking at research. We're looking at so many things. He sort of pioneered going down to Oxford to have a small bowel transplant. Now, he had the operation, and I remember stories about him actually on a bike in the intensive care unit trying to keep as fit as he could from it. And I know it was not successful for him, but it was successful for many others afterwards. And I have a gentleman that comes from the other side of the Pennines who had a very extensive disease and went to Oxford for a small bowel transplant, and I understand did a half marathon recently, and he could hardly walk from the car park to my clinic. Steve Prescott Foundation have donated more than $500,000. I think it's actually nearer 600,000 to clinical and laboratory research at the Christie. I think the links together are just excellent, and I think that was reflected at a meeting we had today when we discussed what we've done and what we hope to do in the future. It's much easier if the Steve Prescott Foundation want to raise money, if they know exactly what they want to raise it for, then it's easier to ask people saying, well look, can you donate for this because we're going to do this at the Christie.